can get started. So everybody, good morning, good afternoon, good evening. Thank you everybody for joining our webinar. My name is David Muniz and I'm from Senha Segura. Before we get started, some housekeeping instructions. This session has been recorded and you receive a copy of the recording a couple of days after this session. Everybody's on mute mode and you can use, of course, the Q&A session to make your questions. And without further ado, and we will, of course, answer all the questions at the end of the session. So without further ado, let me introduce myself. My name is David Muniz and I work for Senha Segura since 2017. I work in the marketing team, researching about cybersecurity and how privileged access management can help organizations to ensure not only cybersecurity, but also business continuity. I'll give the word to Eric first to introduce himself. So who's, if you could give a little introduction about yourself, Eric?
Certainly. So my name is Eric Bellardo. I have been in the information security, cybersecurity world for now this year, 32 years. I've worked with everything from Department of Defense in the United States to civil government and international business in cybersecurity with companies in 27 countries.
Excellent. Here with us is also Felipe Pires. If you want to introduce yourself, Felipe. Now you're living in Portugal, so.
Yeah, exactly. So hi, everyone. And my name is Felipe Pires. I'm Brazilian, by the way, but I live here in Portugal. I moved to live here in January. And I'm security advocate from Senha Segura. And I'm security research from Sapporo. Sapporo is a company from Switzerland responsible to provide specifically product to looking more about how the attacker using different techniques to explore and to gain the privilege access in different environments. But our idea is to talk more about this, how the attacker uses these techniques in the environment. And I'm a security researcher from this company and cybersecurity advocate from Senha Segura. I think you know about cybersecurity. It's a global company responsible to provide a PAN solution. PAN is acronym of the privilege access management and other kind of solutions. And I'm an advocate of the different communities. And by the way, I'm an advocate from Hack is Not a Crime. It's an awesome project. It started in the US, but I think Eric is advocate from this project, right, Eric?
That's correct.
And it's an awesome project. But the idea behind of this project is to talk more about this hacking concept and how the hacking using the creative mind when looking for something because when we talk about the cyber criminals or about for example, the exposure of information or ransomware, is not a hacker. It's a cyber criminal, okay? It's a threat actor. It's not a hacking. Hacking, it's a mindset, it's a lifestyle, how you're looking for something and how you can use your creative mind. That's the idea of this project. We have more than many different advocates in the world. So here in Portugal and other countries like Brazil, like the US and other different countries. So, yeah, this is me. And thank you, David, and thank you, Eric, for being here with us. And we have a pleasure for us to talk with you and for everyone to stay here with us.
Excellent. Well, the topic here is to answer the question, is it possible to keep cybersecurity in healthcare organizations? And we chose this topic because, well, we're 2 years now. We've been hearing a lot about healthcare and the pandemic, the coronavirus pandemic. And we're heading to the 3rd year that this pandemic has been affected the lives of not only people, but also organizations all over the world. And during this period, there was a change in the way that not only companies, but also educational organizations, governments, and of course, healthcare, they work. And in my point of view, the pandemic also has accelerated the digital transformation process And implementing this process is more than just a trend or a hype word. I think it's a business imperative for companies from all industries, since the manufacturing through the healthcare sector, of course, to continue to deliver value, not only to their customers, but also employees and partners. And Gartner has been using a word that calls total experience. And that's not only customer experience, that's also employee experience and also user experience. And making this whole total experience happen is not an easy task. And that being said, I'd like to come to our first question. And maybe you, Eric, could answer this first. How do you see that this whole digital transformation process affected healthcare organizations?
Well, that's a great question. Thank you, David. So as we moved from a traditional model of giving healthcare in both the doctor's offices and the hospitals, we started going through the pandemic and this virtual doctor visits and things of that nature, providing this information to the end users and to the doctors who were also locked down in some areas. So a lot of the healthcare got accelerated to this virtual model. So your threat model changed from protecting an office in a hospital or a healthcare facility to now having to protect the endpoints where the doctors live, where the data lived, where the actual person was at home visiting, like we are on Zoom or some other media. And a lot of things started happening. You know, this remote workforce, the endpoint management, the situation with your privilege access management, and also putting portals out there so that people can see their healthcare information. I know in my hospital here where I go to, they have a portal where I can see my test results, where I can see my appointments, where I can meet with my doctor. So we went from protecting a location and being able to control how that data was accessed to now going to this model of everybody had access to this data. And with that, we had various challenges. How do we protect the data at rest in the data centers, if you will, or the hospitals? How do we protect that data in transit so that we can, log in and see our stuff through the internet? And also how the doctors access both the data in the hospitals and the patients. So there's a lot of changes that occurred in a very short time in the last 2.5 years. And, with this advent, we look at all these different models that we have to do, like, looking at the threat models, looking at the way that, the threat actors are going to attack. How are they going to steal that information? How they're going to get to that information? How they're going to, if we look at the CIA triad, that confidentiality, that integrity, and that availability of the data. And a lot of folks started going the technology route. And then other folks started going what I believe is the crux of the matter is that data model. What are we trying to protect at the end of the day? Healthcare data is data. So we need to protect the data.
Excellent. What do you think of that, Felipe? How do you think that those whole process affected the healthcare industry?
Yeah, when I think about the healthcare, and my thought it's goes to the hospital, as Eric mentioned, and I have an opportunity to work not only in Brazil but here in Portugal and Poland as well in 2019, and I needed to go to different hospital and different culture, but I don't know why, but I saw the same problem. We saw the legacy program in the environment in the hospital. So it's a very a problem because it's the environment. It's totally vulnerable because it's a legacy program. You know, other times I saw in the secretary in the reception when I arrived in the hospital, I looking around the specific place. For example, I saw the password and the access from the users. You know, in the not in near the computer. You know, putting the users, the password. It's I don't know why, but maybe it's they need to receive this specifically, you know, training about the, you know, about the security, how is the dangers. So, but all those things is related to a data. At the end of the day, is the data, right? And the privileged informations and the personal private information from the people from the hospital and the weakness. So it's terrible. When I thought about that, so it's a challenge. It's a big challenge because so how the hospital can changing from the legacy of programs to a new program. So how should be this specifically journey, you know? So this is the big challenge when we think about that. So of course, the company are growing, looking for a different program, different technology, but they still have had, or they still have actually a legacy program. So this is from my perspective, this is a big challenge, not only in Brazil, not only in Portugal, not only Poland, and in different countries.
Yeah, and one more thing to add to that is that hospitals don't have the manpower or the personnel to be able to tackle these challenges. I've been to some of the hospitals here in the United States where they have one or two IT personnel and they don't have a dedicated security person, or they have a small, I don't want to say just one or two, but they have a very small IT environment or IT footprint because that's not their business. That's not what they do. So they have a very small group of people working on these problems, and they have to try to put technology in there to support, and they don't have the money, even though they make a lot of money in healthcare, but they don't have the money to hire for, IT security type situation. So they end up with these legacy systems. I've been to hospitals to do assessments, and they have 20-year-old technology in the basement running databases that, have not been in the industry for years and years and years.
Yeah, it's interesting that you said that, and I have some data here, research that from HIMSS that shows that 73 of security leaders researched, they believe that the investment in cybersecurity should be higher than actually is. And it's interesting that you've said that. And complementing and adding what you two have said, the IT infrastructure has been under great pressure because of not only increased hospitalization, but data traffic as well. And we've seen the security perimeter that has been expanding from inside healthcare facilities. And you've also mentioned the medical equipment. And it's interesting that we see lots of legacy devices in this area. We have we have the wearables, for example, but also we got artificial cardiac pacemakers, ventilators, and scanners. All of those devices, they were isolated from the infrastructure, and they have been connected right now. And the infrastructure has not been prepared for those connected devices. So as we also say that the operational technology, right? And the kind of devices, they have not been ready to deal with the what we call the Internet Medical of Things, those devices that assist not only with the diagnosis but monitoring and delivering of medicine as well.
You have two areas of that I'd like to bring up. So you've got the legacy medical devices. So your infusion pumps and some of those legacy systems that are now being interconnected. Those legacy systems, we've seen in the industry some of those legacy systems running things like XP and, you know, embedded XP and systems and operating systems that are very, very old. And then you've got the new generation of all these new devices that are interconnected, that, you know, directly have Wi-Fi or direct Ethernet connections into these devices. And the challenge that these companies, that these big companies, big global companies that are building these things, is that they're working towards functionality. And it's not been until, I would say, probably the last 1 or 2 years that they've started working on that application security, that operating system security, and the interconnection security. But remember, once those systems are out there, they are not being patched, they're not being upgraded, they're not being, so whatever vulnerabilities existed when those systems were procured, a lot of times these things are not happening. So they're coming with vulnerabilities, and that's where the attackers can go. And Felipe, if you can talk about, you know, what the trend is with using older vulnerabilities in these attacks.
Do you want to add something here, Felipe?
Yeah, actually, this is the good point, because, you know, we have many different aspects, you know, because, for example, we can, when you talk about the hospital, we can divide it into different aspects. Like we have a private hospital and we have a public hospital. It's a good another point, because if you are more deeply about the, you know, administration points, because if you see, and of course it depends of the country, but all those particular places, we have a different administrations, and they have different budgets to investing in cybersecurity and solutions. And not only that, but in the culture that you apply the solutions about this specifically legacy systems or program. Because, for example, if you have a guy or lady, whatever, that working in the specifically protections, so the people needs to, for example, if the people have some culture about the open source products to improve the security solutions from the environment, you know. And the other point is, what should be the approach to apply these softwares to protect the companies in a public way or in a private way. And it's a big challenge, because you know, the people the people that goes to the hospital, not only hospital, but the laboratory or other different healthcare places. So the day by day is about the data, it's about the health, is about the private data, is about, for example, let's suppose that some people suffering about some weakness, or not weakness, but, you know, like a cancer. I think it's a kind of problem of health. So you can imagine, so about the expose of this information to the family, or imagine it's important people of the society. So you can imagine how is the impact of this public people to expose of this specific information. Maybe should be private. So and the big challenge when we talk about the cybersecurity, because so how we can improve that, so how we can protect this specific place. So it's a challenge, and because so how we can give more protections in this specific perimeter. But if this company goes or move to the cloud, so how I can deliver this protection, and how we can move it to the on-premise environment to the cloud. So how we can deliver this solution. So this is the challenge. So maybe Eric has this opportunity to work with the different organizations, different, not only US, but a different country. And but the interesting thing is, we can see the same problem in different countries. It's when it is a private company, when it is a public company, it's usually always the same. It's a challenge, but it's a challenge. Yes, it's a challenge, but we need to think that if it's the same behavior, so maybe if we are a security guy, we can give a good guidance because it's the same behavior, right? So if we apply specifically solutions, or if specifically idea of the protection of the healthcare environment, in this case is the solution that you apply to a specific healthcare, so we can deliver this specific solution from this environment for another similar environment. So it's a learning, it's acknowledgement, experience, and so on and so on.
I think it's a combined factor, not only cybersecurity awareness, but also lack of cybersecurity personnel, as Eric has mentioned before. Just mentioning one case of, I don't know if the people in our audience, they have some stories about that, and of course you can use the chat to tell us some of these stories. But I went to a friend that he's a dentist, and he was doing some exam with a connected machine, and it was a window embedded machine. And then I asked him, how is this connected? And then he just mentioned that it's connected to the regular network. I answered, you did not segment this device in another network? And then he said no. So it's interesting that even though people are getting new equipment, they're not worrying about cybersecurity yet. So that is, I think, one of the problems. Not only the awareness, not only of the lack of personnel, but also the lack of cybersecurity awareness.
Yeah, and the way that a lot of these companies, these doctor's offices. So let's take it from the smaller piece, the doctors to dentists, the smaller piece of the equation. They really don't have that knowledge of cybersecurity. And this is why every time I speak, I say everybody should start learning about cybersecurity. This is an issue that everybody needs to learn. I say that everybody uses technology, but nobody knows technology. Everybody has this very powerful Apple or Android phone, but they don't know what it's doing. They know how to use it, but they don't know how it's doing. So the same thing that happens when you get a phone, you think, oh, I've got an Apple, it's very secure. Well, no, you've got to do things to secure it. When you get this new Android, you've got to do something to secure it. It doesn't just come secure by default. And the same thing happens in the healthcare industry. They get this new technology, they get whatever new technology they're implementing, which is great for patient care. But if you don't place it in the right way, you could be inviting somebody to take over that machine, to get information, to, a data breach or something like that, or a pivot, do that, compromise that device and then pivot to the network to get some more information. We've had, hundreds of data breaches. And just in the last 2 months, we had the, here in this area, in the state of Maryland in the US, the entire Department of Health got ransomware. And they've been working on returning to operation for the last 2 months. We've had the hospital in Andalusia in Spain, that got ransomware. They had a different approach, that they had a lot of backups and they were able to recover very quickly. So, in these institutions, knowing where you're placing your information, knowing how to segment your, I always tell them, patient care network, administration network, guest network, even that segmentation, that basic segmentation is going to help you a lot. So.
Yeah. Also here. I was just going to mention the also that we had cyber attacks here in Brazil last month and the end of 2021. We had our COVID database that was affected. So everyone that needed to take vaccine confirmation and declaration, they could not get any of these of those things because the
Yes, I
systems were
needed to, I
compromised.
needed the certificate of the COVID to when I
Yeah.
moved to Portugal, and I had this problem, But of course, actually, I had the paper printed, and I haven't this document printed yet. But during the travel, I saw this problem with many people. But I will add something about that. The smaller places that Eric mentioned, and I think it's very interesting because but how the small places or the small business can apply security stuffs when we talk about this, because as Eric mentioned, I bought it specifically Apple or Android. It's very safe, but they have specifically, systems, and they using sometimes in Brazil, for example, they're using a lot the WhatsApp to to manage their customers. And I heard something in the specifically body statics. I think this is the place of the with the human go there, and take care of the specific body, and like stuff like that. And the secretary calls me, and she tell me that that they suffering specifically attack using the WhatsApp cloned, because they receiving a link, they click it in this link because they receiving a call because it's from the healthcare sector, from the public sector from Brazil. So we need to send we will send a link to you, so you need to click and you need to update some information about your organizations. And of course, the lady is a secretary, she didn't need no, sorry, she doesn't understand nothing about the cybersecurity, and basically she click on the link and update the information, and after that the attacker, the threat actor, have the access in this specific place. So it's a smaller place, so this is the point. Yeah.
Security is, at the person. So that's one of the things that we need to start doing is to make sure that, when you get a job and you go in work and they give you that once a year security training, and that's not enough anymore. We have to look at the people and continuously train, teach, develop, tell them what's going on. There's these attacks out there that are targeting that social engineering piece, and it's happening a lot in the healthcare industry. Ransomware. You've got the main vector for ransomware malware attacks is the person. It's the phishing, it's the vishing, it's the whaling. So attacking the person, having them understand how that works, not by doing phishing exercises, because we do all those phishing exercises, and what does that do? It tells us how bad, our users are. What we need to do is turn that on its head and say, teach the person. Okay, so that's step number one. The second one is, I tell everybody this all the time. How do you recover from a ransomware? How do you, you can't avoid a ransomware, but how do you recover from a ransomware? Backups and recovery. Okay, 10 years ago, it was a mandate that we did weekly, monthly, yearly backups, and that we tested that backup and recovery mechanism. And over the last 10, 15 years, that's become so down the line that nobody does it. But guess what? If you had good backups, if you had a good recovery point objective, you could say, hey, ransomware gang, don't worry about it. I'm not going to pay you. I'm just going to close everything up, restore, and I've just lost, maybe a week's worth of stuff. As companies start doing that, it's not going to be that profitable.
Yeah, I like to say that it's useless to invest in state-of-the-art of cybersecurity solutions. Of course, it is important to invest in cybersecurity solutions, but if you don't invest on the weakest side of this chain that are people, it's useless for you to have all of these solutions implemented, because as you two mentioned, malicious attackers, they use social engineering to perform the attacks. There's an email that comes, and then if you click, and then sometimes your solution doesn't help against that. And it's interesting that you two mentioned that. Another thing that I'd also like to mention here that is important is that also healthcare organizations, they have to worry about their supply chain. So we're talking about third party. So it's also useless to implement it, to invest in cybersecurity in your application. For example, if you have an insecure API that connects you to a third party and this application is not secure, this vendor, this supplier has been victim of a data breach. So if they are victim of a data breach, then your organization is also victim of a data breach. And it's interesting that I mentioned that because Gartner predicts that 60% of organization, they will use cybersecurity risk as a determinant in conducting third-party transactions and also in business engagements. So, and all of these ecosystem is also not only consider their environment, they're also considering all of the third-party vendor and supplier environment as well.
Too. So one of the challenges is that a lot of the organizations, we already covered the challenges that they have in their day-to-day. We do recommend doing third-party and fourth-party assessments, taking it a step further, we call it supply chain security. Is anybody that is connecting to that network and anything that can introduce a vulnerability into your network. So as you're looking at hiring a company or getting a new service, where are they going to connect, how they're going to connect, and how secure that company is. Let me give you a perfect example. A couple years ago, we heard about that huge attack against Target in the United States, a big supermarket and market company in the United States. Their point of sale system was hacked. But guess what? The company, and I've been to their center in Minneapolis, they have super security. Their stuff is top of the line. They got hacked because a vendor of the one that was repairing the air conditioners and heaters
Yeah,
connected to their system, and then they were able to pivot through the network into that system. So that was a third party. That was not even them, but unfortunately it affected them. And that's happening quite a bit with vendors that are connecting. And so looking at the vendor, looking at the vendor's vendors, okay, so that's what we call third and fourth party assessments, and being able to do that before, and that's before you say, yes, I'm going to give you access to my network. That's very important because supply chain attacks are rising in popularity with threat actors right now. Not only that, but looking at anything that's coming in and the insider threat. So David, I don't know if you're going to cover this, but right now, as of like a week ago with this Ukraine and all the stuff that's happening, there was a report that a lot of the ransomware gangs out there are trying to find insiders to help them, perpetrate these big crimes. So not only your third party, not only your vendors, but also your inside threat.
Exactly. It's a good point that Eric mentioned, because when I started my career in the security field, and the first story that I heard is about the targeted attack. I really like, because I started in the security area in 2015, and I heard this history. I made different research to understand about this attack. It's totally focused on the third party. It's very, very interesting. It's very old attack, of course, but it's not old. It's the new old, because it's happened all the time. It's very interesting, because of that, we need to look in our organizations, and not only organization, but the customer that many times we go to this customer, to visiting, to talk with the people, because the business many times or having this necessity to stay with the third party together with the business. So we need to hiring some different third parties to help you. And many times with the security stuff, so like we need to hire some penetration testing consulting companies, or to making different assessment, and we need to give this specifically access in your environment. Because of that, it's very important you apply different segregations or different layers of the security. So because of that, it's very important to talk about the zero trust approach. So how you can track the specifically access in your applications, in your environment. So how not protection only your perimeter, but how you protect the access, or how you divide this access from your different users. And now I'm working a lot in a specifically topic about how the attacker looking from the user, how the attacker looking from the user perspective, how is the specific access that user have, what is the next step using by the attacker, what is kind of technique using to escalate different privilege inside of these users. So how these users have the privileges specifically inside the cloud, or inside of the cloud environment, because nowadays many company have everything integrated, right? So we have the on-premise environment integrated with the cloud. So from the attacker perspective, so many times they need to explore the victim machine, and after that they gain the access in the cloud environment. So this is the good point. So how we, and not we, when I tell we, it's me and you and your organization. So how we can improve your security environment, putting the different layers. Eric, yes, go ahead.
The first thing that any organization needs to do is know thyself, know their assets.
Exactly.
Remember this: if you don't catch anything from this webinar, the one thing that I want you guys to take away is this: you cannot protect what you don't know you have. Okay.
Mm-hmm.
So your assets, and start at the data. What is my data? What is my golden nugget? What are the things that I need to protect the most? Is it the patient data? Is it the financial data? Is it all these different pieces of data? Where are they stored? Where are they kept? And then you start from there to put that technology around it. A lot of people believe that, we have to defend the castle, the doors, the outside perimeters, putting big firewalls. You know what? The important thing that you've got to protect is that personal data, that people data, that business data, whatever business you're in, that data is what's most important. So start from there and start growing out, and build your castle that way instead of from the old, in. It's very important, because then everything that Felipe and David are saying is your segregation, your zero trust, your how people are accessing this, your privileged access management. So first, know what you have. Second, do your assessments, do your threat modeling. That's very important, that you look
Exactly.
at what is your threat. Okay, is it my biggest threat from hackers coming this way, or somebody inside, or my data being leaked, or this, and then solve for those problems. So
Yeah,
We don't know.
now
I
we
was just
have
going to
two
say,
questions. Yeah, yeah.
Felipe, first, that we don't know where these threats are coming from. So now we have, with the inside, we not only don't have anymore the security perimeter, but with the insider threats, they have the legitimate access. So they have the credentials, they have the access, but they misuse those access. They misuse this trust that was given them. So in this case, I think that, well, in talking about the zero trust paradigm that we are now talking about, I think the focus should be on detect and also respond to those threats. And well, healthcare, and now talking about the healthcare, countries are and states are using this industry to perform those cyber attacks. We have Ukraine, you have China, and now all of these countries that, and of course, the healthcare, we should add that it is part of the critical infrastructure. So in the US, I know for sure that they consider the healthcare as part of the critical infrastructure. And we also talked about this on our webinar for trends for 2022, that protecting and be able to properly detect and respond to those threats is critical for those organizations. Sorry,
Yeah,
Philip,
of
you're
course.
going
Yeah,
to
no,
say?
no. We have two very interesting questions for Eugene, and thank you, Eugene. And the first question, it's not, I don't know if the question is a comment, but I will divide it in different ways. First is all this actually was what does Senha Segura propose for the health sector, considering private hospitals, public hospital, and various consulting practices. And maybe the Dave can give this answer, but from my perspective, the Senha Segura proposed not only specifically with a healthcare or a private hospital. The idea behind of the solution is to work with different environments, you know.
Well,
but the key here, from my perspective, is a good key, is the answer from the Eric. So you need to know about your environment, not only your asset, but you need to understand your infrastructure, not only from Senha Segura, but so how you can apply or implement your zero trust. Because it's a very interesting question for Eugene, but I think it's applied for all those people. Because so how I can apply the zero trust in my environment? Zero trust, from my perspective, is a culture that you can apply that. You using different tools to help you to apply this concept calling zero trust. So, but to apply the zero trust in your environment, you need to understand how your environment works, how your workload works. So how is the different system that you have, what kind of legacy environment that you have that you need to have in your environment, because it's legacy. Sometimes it's impossible to change. So because of that, we need to implement. But so David, please, how the Senha Segura can propose something?
Well, I think there's a couple of problems that Senha Segura helps solving, not only the healthcare, but also but all related to Industry 4.0 and Internet of Things. Well, first we have the access management for third party. As we've mentioned before, third party is a critical aspect that cybersecurity areas need to focus here. So we have remote access, we have different vendors, different tools, different equipment. So managing all the access through those third party, and many of those third party, they perform the access remotely. So we need to identify all of those access. We need to give the right permissions. We need to uniform the means of access and to provide secure access to those third parties. So I think that's the first challenge that Senha Segura helps addressing.
And Senha Segura does something very interesting. And they start out with that audit model. that compliance and audit model. So specifically for the healthcare sector, even though it does not apply to other countries, but having these HIPAA assessments that Senha Segura does for that. That model does apply across the board, and it gives you a way to measure where you are with your security for healthcare. That's a one piece that this company does that will help. It doesn't matter where you are. Then once you look at that, then you can start breaking into the security and risk management pieces that they have with privilege abuse, third-party access, insider threat,
Insider threats.
you know, the passwords and all those different pieces of technology. But you know, always start with an audit. And even if you are in a different country, that HIPAA model is kind of closest to what we have as a global, you know, assessments, doing your meaningful use stage 1, 2, and 3, and bringing that so that then you can get a roadmap of what of the technologies you need to implement.
And talking about monitoring and control, we have through Senha Segura, you can perform a remote session in all of the devices that are managed. And talking about the discovery of those devices, I think first we have to move a step before. Senha Segura's scan discovery capability has been recognized by Gartner as best in class in the privileged access management industry. So we can discover the assets, we can provide secure connections to those actions, we have monitoring and control. We can, if let's say for example, a user perform a suspicious action in one device in a remote session, this can alarm the SOC team, the cybersecurity team, to investigate, and they can close the session, they can terminate the session. Senha Segura allows blocking of commands and full traceability of all the assets. And that makes the investigation aspect very easy because the auditor can just come to the solution, open the video that has been recorded, and the recorded file is highly compressed, so you don't have a lot of storage costs associated. We have reduced storage costs for those videos, and you can easily identify and then respond to not only IPA, but we got also GDPR, and we also all of these data privacy legislation that requires cybersecurity teams to easily identify and respond to those threats.
And while we use the phrase zero trust for the new technology, zero trust is a concept, and different pieces of zero
Exactly.
trust exist. So when people hear zero trust, it's not just a network piece, people, or it's not just the password piece, but it's a thought process. You're doing zero trust means you're doing something you're not supposed to do. Let me challenge you to make sure that you're the right person. If you think about it that way, on the password side of the house, if I log in from here in Philadelphia and then an hour later, I'm logging in from Portugal, something's wrong. Either I jumped on a SpaceX
Exactly.
rocket and landed in Portugal, or something's wrong. So challenge that, on the password side of the house. The other thing is the PAM or the privilege access management, where you can check out a key, do the work that you need to do, and then check the key back. So you don't have to hold all the keys and all the privilege for that box. It protects from, me getting hacked and all of my keys being out there. Go ahead, David.
Yeah, Eugene is also asking the difference between our crypto appliances. So, well, Senha Segura can be implemented as a virtual machine in the customer's infrastructure. It can be implemented on the cloud. been also on premises on our exclusive hardware solution. So we can deliver the hardware solution in different models of appliances. So answering your question, Eugene, the difference between the diamond, the steel, and the silver are pretty much configuration differences and specifications as well, processors, memory. So we need to assess what are your needs in your environment, what you need, the number of remote sessions, the number of managed assets that you have in the infrastructure, and then you can we can size according to the different models that Senha Segura offers. So hopefully that answers your question. So
Yeah.
just to our last question here, do you guys think that zero trust is one approach to ensure that those organizations are that healthcare organizations are safe from malicious attackers? What are the other approaches that you suggest and you recommend for healthcare organizations to use besides zero trust? You can go first, Felipe.
Yeah, actually, it's a good question because it depends actually. Why it depends? Because it depends your environment, the customer environment. It depends if they have 100 employees, 100 assets, 100 applications, 100 instances in the cloud. So it depends on many different points. So the assessment is very important to see that. But when we talk about the zero trust, again, it's a concept, it's a culture that you apply in your environment. So basically, you don't trust in anyone. I mean, so no one is trust. Basically, this is a simple concept. So how I can deliver different access in my environment. So let's suppose that I'm working in the Eric's company, and the Eric is in Philadelphia, and I'm here in Portugal. And if I'm a remote worker, so I need to access some informations inside of the Eric's company. Maybe you are thinking about, okay, you have a VPN. VPN is a specific channel. It's a virtual private network that I can access in encrypted information in this specific channel, okay? But if the attacker perspective, they need to explore me, and the attacker have the access in my environment, and because of that, they gain the access through this specifically VPN inside of the Eric network. For now, the attacker have the access inside the Eric network. But if you have this specifically zero trust concept applied in your environment, you can check this new access in Eric's environment, because the Felipe has specifically access inside of the Eric's company network environment. So you can check, for example, per applications, per access, or locations. You need to apply specifically context, like a location, like a specific protocol, for example. So I can suggest, or I can spend, I don't know, 3 hours to suggest a different solution, but it depends. So this is a simple idea now. Eric, please.
Yeah, zero trust is not a new concept. Let's just be real, okay? It's the new buzzword in the industry, okay? But zero trust has existed. We used to call it insider threat models. Okay, so it's making sure that people are doing what they're supposed to be doing. That's zero trust in its essence. So what Felipe was saying is very, very interesting, because if I hijack Felipe's computer and I can come into my network over here, it's Felipe coming in. Okay, so my system would know that it's something different. But if he starts doing something that he normally doesn't do, now I've got to challenge him. And that's what the new zero trust models do, is look at user behavior, look at their standard model of operation, and challenge the users internally, so that, hey, this is you're trying to get access to data that you haven't gotten. Let me challenge you with a password again, right in the middle of the session. Let me make sure that you are who you say you are. Or Felipe has downloaded 3 terabytes of data from this database that he never touches. Network stop, block. Okay, tell me why you're doing this. So password, privilege access management, user behavior, all of this is new technology that we're putting in a simple way. But remember, going back to what I said, before you go for this technology, because it's the blinky lights and the new stuff, and we like the polished stuff, is look at what you have, your data, how you're protecting your data, how you're protecting your environment, how you are monitoring your environment. Because if you can't see that something is happening, you can't protect against it. So identify your data, monitor your data, and protect your data with different things. Once you know that, now you can put your roadmap into zero trust and all the different AI and ML tools that you can see from this company here, that they have a lot of those technologies to be able to place that zero trust roadmap for you guys.
Well, talking about zero trust, what I see, at least from the customers that I manage, that I deal here at Senha Segura, is that many of them, and I think it's a change of mindset that it's needed here, is that many companies, they just worry about compliance. They just worry about, okay, I need to be comply with those controls. I just need
Compliance
to,
does not equal security, people.
yeah.
Okay.
And I think zero trust is more than giving a check on these audit controls. And we have, well, we could name many of zero trust aspects here. But zero trust is a good approach. But we also have, for example, NIST, that is, it's widely used for security, for compliance as well. But the bottom message here is that zero trust, as my friend Felipe likes to say, is a culture, is a mindset. So it's not only having your company complied with a specific control or a specific regulation, is changing the mindset for security. So for application, the development of applications, they need to be what we call a security by design. We have to implement security in the mindset of everybody. And of course, we could spend the rest of the day here talking about cybersecurity and zero trust. And we're heading to
I'll have one more thing to tell you. So as of like yesterday, the U.S. government, the White House, released a new cybersecurity strategy aimed at reducing cyber attacks. All agencies have to move towards a zero trust architecture.
Excellent. And
yes, I think it's not okay. It's a new for yesterday, I think. Yeah. But I think it's Biden wrote something in another newspaper. I don't know, it's 1 month ago or maybe 1 month and a half ago, to talking more about this, specifically the implementation of the zero trust. So make totally sense. Yeah, it's perfect.
But it came out in September of 2021 that they did the initial draft, but they signed it yesterday. So you're going to start hearing more about zero trust and network and privilege access management and different areas of zero trust in the architecture in the next coming years. So it's becoming something we all need to do. So
exactly, if I can suggest you something, is know your environment. This is the key here in the end of this webinar. For my simple suggestion to you is know your environment and talk with the people, because I've been working in researches and security fields, and has application security guy, helping different companies around the world to suggesting about this application security stuff and all those things related to about the cybersecurity in how the company can protect. And the big challenge is how the specifically environment works, how is the architecture, how is the engineering, the team of the engineering team works, how the developer team works, how the database teams works. So talk with the people. You need to understand how is the flow of the specifically product, for example, and how is the rule of the business. When you understand all those things, when you understand the architecture, you can put in the solution here, and you can understand, you can evaluate what should be the best solution for your environment. But you need to understand your environment. You need to know your environment. So my simple recommendation for you is know your environment.
Couldn't agree more. Know your environment and train your people. You know, we always say people, places, and technology. Technology comes at the end. It's people first. What do you have? What technology? So remember that you can't protect what you don't know you have, both in data and technology.
And we got not only, well, we have different vendors that we can see the importance of zero trust. We got Gartner that has Carta. We had Google that released Beyond Corp. So pretty much any organization that is concerned with business continuity, they deploy, not only deploy cybersecurity solutions, but also adopt those kind of frameworks and
or open source. Create yourself your solution.
And well, just to wrap it up, and I don't know if you have something to add here, Eric and Felipe, so we can, we are at the top of the hour. I don't know if you have something to add here so we can finish our session today.
So I'll just start here. Again, like I said, know yourself, know what you have, know what you need to secure, and train your people. Not once a year. Keep that training, keep that education flowing. And if you can't, you don't have staff, you know, for anybody that's listening, if you don't have staff, go ahead and reach out to companies like this one. Reach out to them and get that help, get that support, get somebody to help you, not only give you that roadmap as a leader, as a CISO, give you that roadmap and that assessment so that you know, at least know where you're at. And also to monitor and support all your information. So thank you very much for coming. Thank you very much for watching. Guys, thank you very much for having me on this webinar. I really appreciate it. And Felipe, to you.
Thank you, Eric. It's a pleasure to be here with you, man. I'm really, really happy for this, and I hope that we have other more. And yes, I completely agree with your recommendations, your words, and I can add, if you need something, people, you can reach me out, you know, about the security, about the career, about, you know, any things. I have my Twitter account, Felipe Pires, and my LinkedIn as well. So you can reach me out and, you know, suggest something. We can talk with me, Eric, David, and everyone here, because we are advocates of the security, right? So we like to talk about the awareness, about the security. You know, Eric has a YouTube channel, very, very nice. Eric organized different events in his YouTube channel. It's very, very nice. And the Twitter account is very nice. Share different, different tools like me and events. And again, informations are here, are there, so we can share with you. So David, thank you so much again, man, and everyone for staying here with us. And thank you so much. I really appreciate it as well.
Excellent. Of course, I could give the same advice that you guys did, but I just want to add here that, well, you don't have to freak out about cybersecurity. You don't have to implement everything together. You don't have to have the state of the art at first. You can start one step at a time, one step at a time. You can start protecting a little bit, and then you can expand the number and the perimeter that you protect in the organizations. You can build maturity one step at a time. So don't worry if you don't have visibility of everything. If you have visibility of just one area or one segment at a time, then you can continuously build cybersecurity in your organizations.
Journey. It's a journey.
It's a journey. Yes, excellent. And that's why I believe that when you execute all the actions that we've been listed in this webinar, it is possible not only for the healthcare, but all of the other industry to protect their environment, to mitigate cybersecurity risks, ensure business continuity, and leave doctors and healthcare personnel to perform their main function, saving lives. So thank you very much, you guys. Hope you all liked our session today, and see you soon. Have a nice rest of the day. Bye-bye.